Hi, my name is Dr. Andrew Gao. I'm one of the ophthalmologists or eye surgeons here at Empire Eye and Laser Center. Today we're going to be talking about cataract surgery. A cataract is when your natural lens of the eye turns cloudy, so it makes it difficult to see. Patients may have trouble reading, driving in the dark, or seeing faces in general. Unfortunately, there's no medicine, eye drops, or laser that treats cataracts, but we can do surgery to remove that cloudy lens and replace it with a new lens implant. We do our surgery right next door in our surgery center, and when you arrive on the day of surgery, you'll receive some medicine through an IV to make you sleepy, and then some numbing eye drops on the eye so you don't feel anything. Surgery only takes about 10 minutes, and then you can go home the same day. We see you back the next day to make sure everything looks good, and if everything goes well with the first eye, which it usually does, we do surgery on the second eye about 2 weeks later. About 1 month after the second surgery, we can check to see if you need some new glasses. So when we put the lens implant into your eye during cataract surgery, we have several options to choose from depending on what you're a candidate for. The most basic type of lens implant is our standard single focus lens. This can correct your vision for either far or up close, but not for both. It also does not correct things like astigmatism. This is an example of what a lens implant looks like. This is kind of the general shape, but don't worry, this is not the actual size, it's much smaller. For most people, you can expect to have to wear reading glasses after surgery and maybe even bifocals. If you have astigmatism that we can detect on testing, we can correct that astigmatism with a lens called a toric lens, T-O-R-I-C. This is a lens implant that corrects astigmatism for distance. That way, without glasses, you'll be able to see well for far away, but you'll still need reading glasses for up close. This is not covered by insurance, and there is an out-of-pocket cost. The last lens implant that you may be a candidate for is a range of focus lens. This is a lens implant that will allow you to see far, middle, and up close without the need for glasses, up to about 16 inches. For smaller print, if you need to hold something up close, like threading a needle, you may still need some reading glasses for those activities. But usually about 90% of the time, you don't need reading glasses. This is also not covered by insurance, and there is an out-of-pocket cost for that as well. The trade-off of having that range of focus is that at nighttime, you may see some little starbursts or spider webs around lights at night for the first 2 months after surgery. This is usually pretty tolerable, patients can still drive, and it usually gets better over the first 2 months as your brain gets used to it. So these are the 3 different options, and depending on what you're a candidate for based on your measurements, we'll talk to you a little further about what might be best for you. Cataract surgery in general is very safe, but every surgery does have some risk. Risks include things like bleeding or infection, but those are really rare, less than 1 in 2,000. Everyone does get some inflammation in the front part of the eye, and so you'll be on some eye drops for 1 month afterwards to help with that. The front of the eye, called the cornea, may become a little bit swollen and hazy, so your vision might stay hazy for 1 or 2 days right after surgery, but then it clears up pretty quickly. A piece of the cataract could also fall into the back part of the eye, and some people need a second surgery to get it. That's pretty rare. It only happens if someone had some sort of trauma or surgery in the eye in the past. And lastly, with any surgery around the eye, someone could lose vision, but with cataract surgery, it's very uncommon. It only happens if there's a really bad complication like an infection. So 99.9% of the time, vision gets better. Hopefully we'll see you soon for your cataract surgery.